Welcome to another episode of Translating Health, a Frontiers CTSI podcast. In this episode, we continue our discussion on pathway programs, and we're first joined by the University of Kansas Health System's Hannah Morales and Kayla Koenig. And later in the program, we will be joined by the University of Kansas Cancer Center's Sierra Wood. Welcome. So I'd like to start with each of you telling us a little bit about yourselves. Hannah, do you want to start?
Sure. So my name's Hannah Morales. I have been at the health system for 12 years now. I started in administration, kind of worked my way up. Actually, I started in the kitchen and worked my way up, but now I am in the nursing practice research professional development department, and I run a couple programs. So I have a high school program called Elevates, and then I have health science interns that I manage.
Great, thank you. Kayla?
Yes, my name is Kayla Koenig. I have been with the health system coming up on 5 years. I started with as a volunteer coordinator for the cancer centers, moved my way over to volunteer coordinator for our 39th and Rainbow location, and I am now our community outreach program manager for hospitality services. So I've been in this position for just over 3 years now. I oversee the shadow program for individuals that are 16 years and older, as well as a lot of our student programming that's not for credit. So Hannah oversees the for credit, I oversee the not for credit, a couple of our volunteer programs, some partnerships we have with local school districts, things like that. So that's what I do.
Great. I was wondering if you could tell us how you got into the positions that you're in, maybe kind of what your background is. Hannah, it sounds like you've really worked your way up, and I think that's something people will find really interesting, and I'd love to hear more.
So the way I worked my way up is my senior year of high school, I started taking culinary courses at the junior college. Started working a couple months after at the health system in their kitchen. After my 6 months in the kitchen, I moved up to admitting where I did registration, which is when I was getting my bachelor's of health science. And then I moved up to the NPRPD department where I was the administrative assistant to the director, Jennifer Williams. Once I got in that department, I started working on my master's of health administration. And now after being in the department a couple years, I was proceeded to the academic partner community outreach program manager role where I started managing these programs. And that role was created a couple years ago. And then I just finished my doctorate of health administration.
Congratulations.
Thank you.
That's awesome. That's really cool. Kayla?
Yes, so I graduated high school and went to a 4-year college where I got my undergraduate degree in family studies and human services, as well as a minor in leadership studies, and then graduated from college and started working at a local church. I was a program director for elementary students for 4 years, and I always knew I wanted to work in a hospital setting, but I realized I was like, oh, I feel like I have to have 3 years experience somewhere to do that. So I went and got what I thought 3 years experience I needed, applied for a position, did not get the position the first time I applied again 1 year later and got a position. So I came into the health system, loved what I do. Like I said, volunteer coordinator, started doing that, and I loved working with volunteers and realized that there was so much in the community that there were so many organizations within the community that we could partner with, and schools were one of the biggest. So a key part of what I was brought onto the team to do was my experience with students. We were really looking to grow our high school volunteer summer program, and historically there were maybe 15 to 20 high school students that would come in over the summer and volunteer with us, and just they were just placed throughout the hospital. There really was no structure to a program, and my director and I spent a year, so 2021, we were still on a lot of COVID protocols. Our volunteers were back very sporadically but not full force, and so we spent that year really developing our high school volunteer program and how could we make it different from other things that students could experience around Kansas City. And we decided to do full day volunteering where they got to volunteer in the mornings, and then in the afternoons we provided experiences. And so We took a program that back in 2019, I think had 19 or 20 students in it. Our first summer running it, we had 50, then we grew to 100, and we grew to 150. And this summer we'll be
Wow.
inviting just over 150 students, volunteers back to the health system. So that was a really big part of, they were like, cool, you've worked with students. We're bringing you in and throwing you in. But now in my community outreach position, I really get to get the voice of the community members, like our school partners, students, and figure out what it is that they're looking for, and working with our teams here within the health system to figure out ways to provide those opportunities. So something great about the health system is they have tuition reimbursement. So I am working on my master's degree right now. I actually graduate in May with my master's in organizational leadership. So looking forward to that. But yeah, just lots of different things going on and opportunities that I wish I knew of when I was in high school. I truly
Yeah.
wish there were things I knew of when I was in high school. So
Well, congratulations on your upcoming
thank you.
graduation. Very
Thank
exciting.
you.
Yeah, one of the things we talk about, or Kelly and I talk about, is, how do we get more students involved in hospital settings that are not just kind of providing direct medical care,
Mhm.
right? Because that's not for everyone. It's certainly not for me. Um, but I still care so much about health and well-being, right? So one of the things we talk about a lot is just what other opportunities are out there. And it sounds like you've got a great handle on that and a great idea
Mm.
of how to still be involved, but not necessarily be like, giving stitches or in the ER or whatever.
Yeah, we say that's a huge part of what Hannah and I have worked really hard on. And I think the two of us have worked hand in hand on this is, when you drive by and you look at the hospital, you think doctor, nurse. Those are like
Yeah.
the first two things that come to your mind. But how can we educate students to understand that there are thousands of jobs, I mean, over 20,000 jobs within the health system that support doctors and nurses. And, yes, there are doctors and nurses and physical therapists, but we also have housekeepers and transporters and cooks down in our kitchens and things like that. So that's been, I think it's been the fun part, is I always call it the wow shock factor. People I'm like, what are you interested in? They're like, I want to be an engineer. I'm like, cool, we have those.
Let
So
me tell
it's,
you how you can be an engineer in a health
yes,
system.
yes.
Yeah.
Yeah.
Yeah, that's awesome. So you said you've got about 150 high school students that will volunteer over the summer.
Yes.
Are they largely pre-med, or are they coming in with lots of different interests?
Lots of different interests. So I would say predominantly, yes, pre-med or interest in the medical field, whether that's nursing, doctor, physical therapy, things like that. But we always are open to, I went out and I made sure that our culinary students within the school districts knew that we have volunteer roles in our kitchens. Like, you can go down and volunteer if you truly are interested in becoming a chef one day. You can volunteer in our kitchens, or if you want to be like, if you're just interested in guest services and you like working with people, you can be a pathfinder. I mean, that's going to teach you really good communication skills and just learning how to work with people. So
Yeah.
we have positions for everyone.
That's great. How do students go about getting connected with you?
For volunteering, I say the easiest way is if you just Google volunteer at KU Med. It pops up and it takes them to our website with a little bit of information. So we've got two separate programs. One is for rising freshmen, and that is for 8th graders entering their 9th grade year. We found that it was just really easy to get lost in the mix of some of these students. Some students are coming back for their 3rd or 4th year and they know what they're doing, but sometimes that when you are 14 years old, it is your first exposure to a hospital setting, could be. So volunteering on your own, being in a clinic by yourself, and just being expected to take up and do your own things and know exactly what to do, it was harder. So we've created a separate program this year for rising freshmen. Like, they're coming in on Fridays and they'll be in groups of 4. So they won't be alone, and they'll really just be learning about our non-clinical. We've got 4 departments we're going to be teaching them about this summer, and really just getting a feel for this environment, so that if they decide to reapply next year, for our volunteer program, which is our core high school volunteer program, this isn't a new environment for them. They feel comfortable here, which then in turn would hopefully make them a more successful volunteer. So applying applications open January 1st every year, and interviews are held by our volunteer coordinators. Interviews start pretty quickly. Often once the new year hits, early 2027 will be our next round. So applications are closed for this year. We've started making our selections already for this summer, but January 1st is when I'm telling students, if you're interested, just keep checking our website and apply
Okay.
January 1.
Great. That sounds like such a good structure for incoming freshmen.
Yeah,
As you
I
said,
hope it is. This is our pilot summer, so it'll be the first time
Okay.
that we've tried it. So hopefully it's successful and we continue to allow it to grow.
yeah, I think that's such a great idea. They're working in teams because, as you said, it could be so overwhelming, if that's your first kind of hospital experience.
Yes.
So that's really neat. So, students who apply, does everybody get in, or what's kind of the process?
Yes, so we do have, it's a very competitive program. We are seeing, I think we had just under 300 applicants for our volunteer program, that core high school, and we only accept 100. So 50 of those 150 are returning students. Those are students who have been with us in the past and they're coming back in a different format. The structured one is accepting just around 100.
Okay.
And so it is competitive. Unfortunately, I say unfortunately, it's great that it's competitive, but we wish we could say yes to everybody. We truly do.
Yep.
In the Rising Freshman program, we had 37 apply and we can only accept 16, so about a 50%
Okay.
acceptance rate. But it just shows how competitive it is. But yes, we do have to say no to some people, but we encourage everyone, if we say no to you this year, please reapply. There are so many good candidates and we can only say yes to so many. So I never say, don't let it discourage you. What can you work
Yeah.
on throughout the next year when it comes to communication and building your resume and, all of those things? What can you do to become a better applicant?
Right. Right. Yeah. So obviously you're with the health system. Do you ever refer students who maybe don't get accepted into the program to other hospitals in the area, or do you tend to just kind of keep with the health system?
I have always been open and said, if you have not, please check others. We do Olathe.
Mhm.
Our Olathe campus has a volunteer program. I believe our deadlines are very similar across
Okay.
the city. So my hope is that students are applying for multiple.
Yeah.
I know we had a couple that applied for our Olathe program as well as this program. I know Children's Mercy has a volunteer program for
Yep.
teenagers. And I'm sure other hospitals do too. I believe North Kansas City does as well. So I'm telling you, just look up, don't put if you want, put all your eggs in one basket. You are welcome to. But it's good to apply to multiple programs, because I am assuming that almost all of them are as competitive.
Yeah.
We do, though, if students are over the age of 16 and they apply, we have a shadow program that I run as well. And so I'm always offering that if you've not been accepted as a volunteer, I'm very open and willing to help you work through opportunities on the shadow side of things. So it's almost like you were not accepted, but here are some other opportunities that we have
Yeah.
here.
Yeah. So what is the shadow program activities?
Yeah, so shadowing, it's open for anybody over the age of 16. It is 1 day per sponsor. So students they can apply for as many different experiences as they would like to, but it's just 1 day per person that they're shadowing. And a
Okay.
sponsor is the staff member that's employed by the health system, whether that's a physician, a nurse, a chef down in our kitchen, whoever it may be. They can shadow any type of career that they are interested in. There's an application process. We ask that to allow for about 30 days to process applications because we get a high amount of applications. But that's through all of our locations across Kansas City, including Olathe, Paola, all of our offsites, our 39th and Rainbow campus. So if students are interested in the clinical shadowing, they can apply for that. You can just type in shadow at KU Med, shadow at the University of Kansas Health System. It's embedded into our volunteer website as well. So, and Elevates information lives on that page as well.
Great. One last shadow question, and then
Yes.
let's switch gears.
Yeah.
Is that year round?
It is 365 days, 24 hours a day. That thing never shuts down.
Awesome.
Yep, it's
Great.
open all the time.
Great. Okay, Hannah, your turn. So yeah, can you tell us about the Elevate program? This is more for college students?
So Elevate is high school juniors and seniors. So we
Okay.
do have 13 school districts that we're affiliated with. So kind of the process of what that looks like is a student could reach out to us and we'll see if we're affiliated with their high school, or a school reaches out to us and we see if we have space for an affiliation. Currently, we are booked at our 13 affiliated institutes. We aren't able to expand that at this time. Even with having the other locations we just acquired, we aren't able to expand those numbers yet. So there are quite a few schools on our wait list, but right now we work with 13 school districts. And so the application process is more so one teacher from each school district is our contact, and they get to pick which students go in that opportunity. A lot of them have specialized CAPS programs or AP classes that determine whether the student's eligible to shadow at other health systems. A lot of them do go to multiple around the area. So when they come to our health system, they're here a couple days a week. It's usually fall and spring semester, so they'll usually come for a whole semester and see 2 different areas of the health system, whether that's clinical or non-clinical. And they're usually here for a couple hours whenever they're on campus.
Cool. What kind of activities do they engage in?
So it's a little less hands-on. It's more so elbow to elbow with the person they're shadowing. So they're told that they can shadow anyone on the unit. Usually the nurse educator coordinates that or picks someone for them to shadow with for that day, whether it's a tech, nurse, PT, OT, physician, resident, anybody on the unit, they're able to shadow with them. And some of our students have really great experiences, like the operating room and seeing babies delivered and labor and delivery and all these wonderful things. And then some of them, it's just like a typical day at the hospital. They're just checking patients in, taking them to their room. So everybody's experience is a little different, especially because we have around 150 students every semester. So not everybody's going to get an OR spot or an ED spot, but they do all get a nice variety experience.
And they're doing this for high school credits?
Yeah, so most of the high schools are accredited with some kind of institutional body. So like some of them are through Kauffman, they get a market value asset credit. And then through, when I was working with Olathe High School, they were saying that a lot of the Kansas high schools have a certain graduation requirement that they consider like a value added asset for when the students graduate.
Yeah, I'm not from here. I didn't grow up in Kansas or the Kansas City area, so I don't know very much about all the high schools and requirements and all that. So it's fun learning a little bit more.
Yeah, so I think nowadays, most of the schools, it's part of their graduation requirement that they have to have some kind of real world life experience or, market value asset, some kind of value that says that they were shadowing and engaging in the community in some sort of way.
Okay, that's great. That makes sense.
I know, it's new. I wish they did this when I was younger. It's wonderful.
Right? I mean, that's what I'm always thinking too is, gee, what if that had happened when I was in high school? That would have been great.
Yeah.
Would have figured out what I wanted to do maybe a little sooner. But are there any programs, I guess maybe not programs, but specialties that seem to be more popular than others?
I would say half the class predominantly wants to be a surgeon of some type. And then the other half, I get a lot of anesthesiologists, radiologists, and then nursing. I feel like a lot of it is I want to be a pediatric nurse, or we have a couple that wanted to be oncologists. You never know. Every semester is so different. And we have some students that take the non-clinical route that are like, I think I want to do one of our paid internship programs at the health system or something like that, where they start doing their MA or getting their their certificate in pharmacy. But a lot of the students already know what high school or what college they're going to go to, or at least what route they kind of want to be on. So this kind of solidifies it for them, or tells them, oh my gosh, you made a mistake. Let's go back to the drawing board. You don't actually like this.
I don't actually like cutting people open. Okay. With shadowing, that's not necessarily a hands-on kind of activity, right? It's more you get to see what's going on, but you're not actually, for legal reasons and safety reasons, you're not actually touching patients and that kind of thing.
So our program is different than the other campuses, because some of the other campuses have their own set of rules and some of them are hands-on, but the main campus, we don't do hands-on shadows.
Okay.
Sometimes they might take vitals with their nurse, but it's nothing like, oh, they took the vitals and the nurse charted whatever they said. It's a very like, we're doing everything together.
Yeah.
And nothing invasive.
In order to touch, we say in order to touch a patient, you have to be employed by the health system, have a certificate or licensure. So if you are a student and you're shadowing or volunteering, you will never be touching a patient.
That makes
to
sense.
go back to your previous, just talking about where do we see the most students' interest in, to follow up with that, the biggest advice I can give to students is to be open-minded. You may think you know what you want to do, and it's not until you actually see what the day in the life of that job is, or you get to talk to somebody in that specialty, whether that's, they want to be a surgeon or they want to be an OBGYN labor delivery, something like that. They be open-minded. Don't set yourself so straight on one thing. I think that's something that's so great about shadowing, whether that's for credit through Elevate or not for credit through our shadow program, is be open-minded and allow yourself to see multiple different experiences, because you may realize you're interested in something that you had never even thought of before.
Absolutely.
Yep. I think at the beginning of the semester, the amount of students that come in and they're like, I'm going to be a surgeon like my dad. And then, sometimes we have to really hit into them, and not hit into them, but, we have to make it clear, hey, we work as a team. The janitors are going to get the same respect as the CEO, the same respect as the nurses, because everybody works so hard together. And then they do their shadow and they're like, wow, I've seen the nurses do a lot more than I've seen the doctor do, or vice versa, because they're only here a few hours a day. And so just in that little bit of time, they see, oh, okay, I do give credit to the nurse. Maybe I do want to be a nurse. And I think you just have that stigma from what you see. Or let's be honest, they're high schoolers. A lot of them come in with, I saw this on Grey's Anatomy. Where's your gallery? Where's this? And I'm like, oh gosh, that's really not what happens here all the time.
I know. Yeah, where's your gallery? They're like, do we get to see one of those galleries where we can like watch a surgery? I'm like, they don't exist.
I was like, sounds good, but no.
Yeah. Great. Thank you. Is there anything that I should be asking that I have not asked yet, or anything else you would like to share?
I do have one thing. We also here at the health system, we have jobs open for 16 and 17-year-olds. We hire 16 and 17-year-olds. They are in PRN positions, so kind of as needed to help fill those gaps in open schedules. So we do hire 16 and 17-year-olds, and we do also have entry-level jobs. So we do have jobs here full-time once someone's turned 18, if they are looking for a full-time job. We have jobs that you don't need a high school diploma for if you want to apply. We have some that require just a high school diploma that you don't need a college degree for. And then we have all of those as you go up that you need a college degree, you need a master's degree, doctorate, whatever. So we have opportunities for anybody over the age of 16 and older, if they are interested in careers. So that's another thing I would not be doing my department justice if I did not highlight. So some of those are the 16 and 17-year-old positions we have in dining services, housekeeping, and I think we're working on transport.
Okay.
For if students are looking for like a good summer job, that's a great opportunity to get in and help fill some of those schedules in during the summer, or after school or weekends. We have quite a few. So if students are interested, we do have those. Just look those up on our career website. I think they're listed as student PRN, if you look those up.
Yeah, those are great opportunities. They even have patient care assistant if you want like your first taste of healthcare to get your foot in the door. That's all we tell everybody. I feel like me and Kayla always tell people, just get in where you can get in and work your way
Yeah.
up.
Yeah, start somewhere.
Yes.
Yeah.
Once you're in the health system, it's a lot easier to get where you want to go because every 6 months you're eligible to transfer. While as when you're trying to get a job at the health system, it seems like such a long, lengthy process. So it's a lot easier once you're inside.
Yeah, we just were talking about this in a meeting. There's a high school senior girl who just applied for and just started with us this week in dining services, but she knows she wants to be a nurse. And so she just is getting her foot in the door at an entry level position. She just turned 18, so she's like, sweet, I'm gonna apply. And she's gonna work in dining services until that next opportunity comes available for her. But her highlight is we have full ride nursing scholarships, the Reach for the Stars nursing scholarships. And she's like, I'm going to apply for that when I'm eligible to. And she may end up going full ride scholarship for nursing school, and she can come back and get a job here as a nurse, and she'll be able to say that she started in dining services. So it truly is, if students are willing, it's almost like playing a game. If you are willing to play the game right, we like to set people up for careers, not just jobs.
Yeah.
Here.
Yeah, that's fabulous. That's great. So my closing question that I like to ask is, do you have any fun memories or stories from your job or the programs that you run?
The one that comes to mind, I just brought this up in a meeting. I mean, I have so many that I could share, but I think one that comes to mind is working with students personally. I love seeing when someone, when you interview them for a volunteer position, or you reach out and you see this just very shy, maybe like introverted person. And, others might look at that person and go, oh, they're just going to drown at this place because it's so big. There's so many people. There's so much going on. I'm like, no, just watch and give them the summer. I love watching those students that come in, our shy students that come in on June 1st. And then when they leave July 31st, you're like, you're a whole new person. I did not know this person existed inside of you. You are so outgoing now. And it's because they were put into an environment that truly brought out the best of them, that they got to grow. They felt comfortable growing. They learned, they just succeed. And then we see them back the next summer and I'm like, oh my gosh, you're growing even more. You're doing even better than you were the first time I met you. So I love watching students grow into the person that they're becoming, and knowing that a big part of that is just the opportunities that we have that we can provide them play a big part in that.
Sounds like you're in a perfect role.
I love it.
Yeah.
I would say that's one of my favorites too, because throughout the semester, you see them develop their soft skills and come out of their shell. And it's like a whole different person. I think in their first few weeks, it makes us as program managers a little bit nervous, right? Because they're shy, they don't want to engage, they're just not ready for the world. And then as they start becoming a little more comfortable, they're like, I'm talking to patients now. And, I advocated for myself to ask if I can go here and there. And just the confidence that they get over time, it's really night and day.
Yeah. Yeah. That's so great. Great opportunity. That's, again, just wonderful examples of how to be involved in the healthcare system in so many different capacities.
Yeah.
So, well, I won't take any more of your time, but I really appreciated learning about all of these opportunities, and I feel like high school has really changed.
It really has.
High school.
Yes. Well, thank you so much for having us.
Thank you.
Yeah.
Always fun to talk about what we do.
Thank you both for your time. Now we're joined by Sierra Wood. Why don't we start with you telling us a little bit about yourself?
Sure. So my name is Sierra Wood. I'm the program manager of training, education, and development at the Cancer Center. I grew up in Kansas City. I'm a longtime Jayhawk, Rock Chalk. I After high school, went to college in Vermont, where I studied literature. I just wanted to read in the woods. And after that, I moved to Washington, D.C., where I did strategic planning around access to healthcare. I've always been really passionate about folks being able to get the care that they need when they need it and the way they need it. But at a certain point, I was ready for more school, so I moved back home for in-state tuition here at KU Med, where I got my master's in public health on the Kansas City campus. And so after doing some research, cervical cancer prevention for folks with histories of incarceration, I moved over to the Cancer Center. And now I work with high school students, undergraduate students, graduate students, postdocs, and staff on training initiatives and education initiatives. So similar to what I was doing after college, I'm excited to make sure that people are getting the education that they need, the training that they need to be successful in delivering great care and doing amazing research.
Wow, that's great. That's a perfect segue into the ACE program at the KU Cancer Center. Can you tell us about the program?
Absolutely. So the ACE program, the Accelerate Cancer Education Program, is a 6-week summer internship for high school students who are interested in the biomedical sciences. One thing we love to say in our work at the Cancer Center and at KU Med is that you don't have to be a doctor or a nurse to be successful or to be a part of our campus or to be a part of healthcare. We love our doctors and we love our nurses, but there's so much more to the care team than those two great components. So to the Accelerate Cancer Education Program, the ACE program runs from June 8th to July 17th. You have to be 16 to participate, either a junior or a senior in Wyandotte County or Jackson County. And when you come onto our campus for this program, it is a paid program, you get to have hands-on experience and hands-on exposure to what it's like to be a cancer researcher. So sometimes that's in a wet lab, like a traditional scientist, Dexter's lab style, doing science, doing research with pipettes under a hood, or sometimes it's public health research. We had a student who once designed a graphic novel about cancer research and having communication to folks about cervical cancer. We also have folks who are doing data science research, which is really cool. They learn different types of computer programming to understand the spread of cancer in our region. But what's really great about this program is that it introduces students to the entire world of cancer research through one-on-one mentorship with faculty, with other researchers in the lab. They get to have really authentic research experience, and then they interact with all different types of oncology professionals. So they get to meet doctors, they get to meet researchers, they get to meet people from our School of Health Professions, so physical therapists who are doing research. And then they're also meeting communications professionals and architects. We just have so many different folks that they get to interact with who are all working at the Cancer Center.
How many students do you have each summer?
We have 12 each summer.
Okay. What does a typical day look like for students in this program?
So a typical day for an ACE student, they start the day and they get to hang out with me and a couple of my other colleagues. So I don't know if that's a plus or a minus for the student, but they will start the day with us and they meet an oncology professional. So for example, they may meet a genetic counselor from the Cancer Center and they learn a little bit from that person or a different one about how they got to be at the Cancer Center and a little bit about what their career is like. And then from there, they will go to their research lab where they get to do their research all morning long. They're learning from their mentor, they're learning from the people in their lab about how to do research, and then they get to do the research themselves. So they're contributing in a really real way to the research that's happening in that space. And then they get to go to lunch with their colleagues. Sometimes we will have a lunch with another oncology professional, like a lunch and learn. And then in the afternoon, they head back to their research experience. And then they head home for the day. So it really is like a job. And because they're 16, we'll treat you, the students, like adults. You get to be in control of your experience, with the appropriate guardrails.
At the end of the program, do the students present their work?
There is at the end of our 6-week program, there is a summer poster forum where students present a poster in a research format of the data that they've collected of their research project. And there's a poster presentation, there's a lightning talk, which is when you give a talk about your poster. And there's, there's almost 200 people that attend this forum, including leadership from our campus and principals from the school and families and friends. And it's a really great opportunity to share your work and to get practice for doing research in the future. And students create really great presentations, and some of our students have gone on and presented that work at national conferences. And so it's a really cool way to demonstrate all the amazing work that you've done. And at the beginning of the program, a lot of our students, including me, are like, what's a pipette? What's a hypothesis? And by the end of the program, you're the one who's doing the teaching. The student is doing the teaching. So it's so cool to see how people have grown in confidence and grown in knowledge throughout the program.
That sounds like such an amazing experience. How long has the ACE program been around?
Our program started in 2018. We took a year off in 2020 for COVID, but we've been going on since 2018. And we now have had students who've gone on to complete college. We have students that are in medical school, who are in graduate school, who are in the workforce. So it's been really amazing to see how their career trajectories have gone with ACE, and students who have participated in more of our programs. We have, as I was saying, we have programs for undergraduates as well, and we have programs outside of the Cancer Center, which I know your listeners will hear about as well. So we all get to talk to each other, and we all get to see how our students are successful because they're amazing students and they come to our campus and get to learn more about how science contributes to their community.
So for students that have gone through the program, do you have a way to track what they're doing now, or do you keep in touch with them?
While students are a part of our program, we ask them to create LinkedIn profiles. And so we know that's a really great way to build a professional network. And so we stay in touch with students on their LinkedIn profiles. And we also stay in touch with students just over email or text. We are always available to write references for our students. I've written a couple this year myself, and I know my colleagues have written references because our program is so competitive, and because it's a paid program, it becomes a really great resource for students after they've gone on to compete in for other applications or for jobs. We get to be a really great resource for students. So we do get to stay in touch and see how their educational and professional paths go.
If someone is interested in participating in the ACE program, how would they apply?
The easiest way is just to give us a quick Google. If you Google KUCC space ACE, ACE, we are the first hit that comes up at kucancercenter.org. That's the best way to find us, and all the information about our program and the different requirements are on our website. You do have to write a personal statement when you apply, which is great practice for jobs and great practice for college. You have to do a cover letter or a different type of personal statement. That's how you will apply. And another thing we're really passionate about in this program is getting you ready for that next career stage, whether it's college, a 4-year college or a 2-year college, or going to the workforce. We're really excited about preparing students for future opportunities in science and healthcare, or maybe you decide that science is the worst and you never want to do it. That's also something that we are happy to help you discover.
With the new KU Cancer Center building, is there a possibility that this program could expand to host additional students each year?
That's something we would love to see happen. We're really passionate about making sure that there is great representation from everyone across our state and across our community. And so we would love to see more students. The more the merrier.
So my understanding is, in addition to the ACE program, you and some of your colleagues also speak at high schools. Can you tell us about that program?
Yeah, so one thing we know is that classroom career exposure makes people feel more confident. The more you know, the more confident you are to use that knowledge. So we visit both middle schools and high schools to talk to students about all the different careers that are in the oncology workforce and what cancer research looks like on our campus. So we, again, talk about careers like doctors and nurses, and we talk about traditional biomedical careers as well. We have this great infographic that talks, that you can see on our website, that talks about what a patient's career or cancer journey looks like and all the different careers that you interact with along the way, whether it's a veterinarian. We have veterinarians on our campus, or a social worker, or a genetic counselor. But we also have some really cool discoveries where we talk about how somebody who's interested in architecture or art or accounting can really contribute meaningfully to our mission here at the Cancer Center, which is to make sure that everybody has a long and healthy and productive life. And then going out in the classroom reminds us what's so great and exciting about science, which is, learning and teaching and discovering.
Wow, I think it's great that you can show students that there are so many more careers than just being a doctor or nurse. Really, they have endless opportunities to be involved in healthcare and research. Approximately how many schools do you visit in a year?
We are probably visiting 2 to 4 classrooms a month. Really love having students help us learn about what is interesting to them about science. That is what helps drive us personally and professionally, and what helps change the science.
If a teacher is listening to this and is interested in having you come to their school, how can they reach out?
The best way is to shoot us an email. Our email address is kucc-ted, TED, @kumc.edu. So again, that's kucc-ted@kumc.edu. TED is our acronym. It stands for Training, Education, and Development. So please just shoot us an email. We love to hear from folks, whether student, teacher, parent. We'd love to set something up and come see you.
So as we wrap up, do you have any memories or fun facts about the ACE program or your time with KU Cancer Center that you'd like to share?
I think my fun fact or fun experience, the ACE program is my favorite time of year. It's our busiest time of year, but it's also the best time of year. Having students on campus reminds us why we do what we do and how special our campus is. I think as you come to work every day, you love your job and you love what we do, but it kind of gets to feel like the same thing. But when students come onto campus, it reminds you how special it is, the things that we do. And so I love the ACE program for that.
I love that. I love opportunities for folks to see just how exciting science and medicine can be. Sierra, thank you so much for joining us today. There are so many great pathway programs out there for students interested in careers in healthcare and research. And I really encourage students to explore them and see what piques their interest. Thank you for listening to Translating Health, a Frontiers CTSI podcast. This podcast is hosted by Dr. Heather Fielding Gebhardt and produced by Kelly Hale.